let's say you're just noticing the early signs of hair loss, and for men or for women, it could be a little bit of shedding, extra shedding in the shower drain or on your pillow and such, or you just notice that the overall volume of your hair is changing or texture is changing. That's a sign that you should get some kind of evaluation from a board certified hair restoration physician like myself. And one of the things that you would do when you first come in, before we start to talk about any kind of therapy or treatment, as I mentioned previously, is we want to get a good genetic history. We may do some DNA testing. We want to get some density measurements at the level of the scalp. And we've got some interesting ways to do that today. We have an AI-powered microscope that looks at the back of the scalp where the hair follicle density should be pretty good. And we go around to different areas that are kind of bellwether zones where you would normally see some early thinning under the microscope, but maybe not noticeable yet to the naked eye to determine what's going on. So again, once we have a good solid diagnosis, we'll look at those genetic factors as well as the lifestyle factors, and maybe we make some adjustments. So, for example, if you've got, let's say you're on a special diet, you're on a weight loss program right now, you're trying to get leaner, and it could be, maybe you're on a caloric restrictive diet, or you're on a fasting or intermittent fasting regimen. Or maybe you're on a weight loss medication like a GLP-1 agonist, or you're a strict vegan or vegetarian. Maybe you have trouble getting enough protein in your diet. All of these factors could potentially impact how your scalp is making hair. Think of your hair follicles like little 3D printers, and their job is to make that long, skinny fiber, hair fiber. And if you don't provide it with enough ink, if you don't provide it with enough building blocks of protein for hair, you're not going to grow good hair. So it all starts with these, holistic approach first. So nutrition, diet, regulating stress, because cortisol is a killer for hair follicles as well. We want to know if you've been hospitalized, you've been under a traumatic situation. I just saw a patient literally about an hour or two ago, and about a month ago, he was in a very traumatic car accident, and it was an awful amount of shedding that occurred. And this is a gentleman who has had multiple transplants. He's been on medical therapy, and he had a hugely stressful, psychologically stressful and physiologically stressful event that triggered a massive bout of hair shedding and loss of coverage. So those are all some of the different things that we would start with. But yes, it's always the least invasive things first. So it could be some nutritional modification, those lifestyle changes. We could use some non-pharmaceutical treatments like an at-home FDA-cleared laser light device, a medical-grade laser like the turbo laser cap or something. Younger patients often do great with PRP because their stem cells just rejuvenate really powerfully from that kind of a therapy. But yeah, we're going to start with those things, or maybe progress to medications and pharmaceuticals after that before we do anything regarding hair transplants.